If you're over 70 and your knees ache before you even take your first step in the morning, or they stiffen up halfway through a walk and you have to cut it short, I need you to watch the next 60 seconds before you do anything else. Because there's a simple thing you can do right now, sitting in a chair, that physical therapists actually use in clinical settings to prepare knee joints for movement. It takes about 2 minutes. It requires no equipment. And I'll show you exactly how it works, why it works based on real anatomy, and, just as importantly, what it cannot do, because there's a lot of overblown content out there promising miracles for knee pain, and you deserve the honest version. The real problem with stiff knees after 70. Here's what's actually happening inside your knee when it starts aching as you get older. The knee joint is cushioned by cartilage, a firm but slightly flexible tissue that covers the ends of your bones and lets them glide against each other smoothly. Cartilage doesn't have its own blood supply the way muscle does. Instead, it gets its nutrients from synovial fluid, the lubricating fluid inside your joint capsule. And here's the catch, that fluid only moves and circulates when the joint moves. A joint that isn't being gently moved doesn't circulate its own lubricant very well. That's part of why knees feel so stiff and achy first thing in the morning, or after sitting for a long period. The joint has been static, the fluid has settled, and the cartilage hasn't been nourished or prepared for load. That's not a theory. That's basic joint physiology, and it's the reason why physical therapists have long used gentle range of motion work before putting weight on a joint, to prime it before loading it. The chair fix, what it is and how to do it. The chair fix I'm going to describe is called a seated knee extension, and it's been used in physical therapy settings, including post-surgical knee rehab, because of exactly that mechanism. Gentle, non-weight-bearing movement that encourages synovial fluid circulation and warms up the soft tissue around the joint before you ask it to bear your full body weight. Here's how you do it. Sit upright in a firm chair with your feet flat on the floor. Make sure your back is supported. Slowly straighten one leg out in front of you, lifting your foot off the floor, until your knee is as straight as you can comfortably get it without forcing it. Hold that position for 2 to 3 seconds. You should feel a gentle tension in the front of your thigh, that's your quadriceps engaging. Then slowly lower your foot back to the floor. That's 1 repetition. Do 10 on each side, moving slowly and deliberately, never jerking or forcing the range. The key word there is slow. The goal is not to build strength in isolation, though some quad engagement does happen. The goal is controlled movement through the joint's range of motion before you stand up and put your full body weight through it. Why this actually helps, the real mechanism. So what's happening physiologically? A few things. First, the movement encourages synovial fluid to distribute more evenly across the joint surfaces. That's the lubrication effect mentioned earlier. Second, the slow quadriceps contraction warms up the muscle group most directly responsible for stabilizing the knee. Weak or cold quadriceps are genuinely one of the most documented contributing factors to knee pain during walking in older adults. That's not opinion, it's been reproduced in multiple studies looking at gait mechanics in people over 65. Third, gentle pre-movement can reduce what's sometimes called morning stiffness, a phenomenon where connective tissue and the joint capsule feel tighter and more resistant after a period of rest. That resistance decreases with gentle movement. None of this is magic. What it is preparation. Think of it the same way you'd think of warming up a car engine in cold weather before putting it under load. You're not fixing the engine, you're giving it a better chance of running smoothly in the next few minutes. Honest caveat, what this cannot do. Now here's the part that matters and almost nobody says. A 2-minute seated exercise before your walk is not a treatment for arthritis. It is not going to reverse cartilage loss. It is not going to fix a meniscus tear, a ligament problem, or inflammatory joint disease like rheumatoid arthritis. If your knee pain is severe, getting worse, accompanied by significant swelling, warmth, or redness, or if it's limiting your daily function seriously, that's a conversation for your doctor, not a chair exercise. What this does is address one specific, real, documented factor in knee discomfort before walking, the transition from a rested joint to a loaded, moving joint without preparation. For that narrow but genuinely common problem, the evidence that gentle pre-movement helps is solid and the risk of trying it is essentially zero. That's a meaningful combination. If this kind of honest, mechanism-based health content is useful to you, where we show you what the research actually says instead of what makes the most exciting headline, follow this channel right now because that's the only content we make. What to pair it with? A couple of additional points that will make this more effective if you use it consistently. First piece. After your seated extensions, when you do stand up to walk, start slowly for the first 2 to 3 minutes. Let the joint continue warming under gentle load before you increase your pace. This lines up with how physical therapists structure gait training: load progression, not immediate full effort. Second, consistency matters far more than intensity here. Doing this every single day before your morning walk or before you get up after a long sitting period is more valuable than doing it hard occasionally. Joint nutrition through movement is cumulative, not acute. Third, if you're already doing water exercise or cycling, those activities provide similar low-impact joint movement for the same reason. The load is reduced while the range of motion is maintained. The safety note. One thing worth mentioning clearly: if you have had a total knee replacement, a recent knee surgery, or significant instability in your knee joint, check with your physiotherapist before adding even gentle exercises without guidance. For most people over 70 with general age-related knee stiffness, seated extensions carry no meaningful risk, but you know your own history better than a video can. So to put it plainly, there is one simple, evidence-supported thing you can do before your next walk that costs you nothing, takes 2 minutes, and is grounded in real joint physiology. It won't erase arthritis, and anyone who tells you otherwise in a 30-second reel is selling something. But it will give your knees a better start than getting up cold and walking straight into full load. And over time, that kind of consistent preparation adds up. Share this with someone who's been shortening their walks because of knee stiffness. And follow now, because the next video covers another specific joint preparation technique with even more evidence behind it, and you'll want to see how they compare.